I'm Dave Duplay. I'm here with Hans Schmoll from Germany, an oncologist and hematologist. Hans, I'm interested to know what you're finding in the area of colorectal cancer and new therapies that are being provided to patients.
We are just in a time where many new treatment options are developed, or developed drugs are used now also for colorectal cancer. And this is just really starting like you open a window. Just for example, before we had only one colorectal cancer, one type. Then we had a second type, those with KRAS mutation or KRAS wild type. So it's a second diversion of the treatment possibilities by adding a so-called EGFR inhibitors, a targeted drug. And now we have two other subgroups of colorectal cancer, which is a BRAF mutated, very rare, luckily, because it's a very poor disease. And then we have the HER2, we know this from breast cancer, HER2 or HER2 and the new expression, overexpression tumor, which is about 5%, 7%, depending on up to 8-9%. So it's a more substantial number of patients who has been found to have extremely benefit even in third and fourth line of treatment by HER2-oriented treatment, like in breast cancer. And now we start to separate these different groups in first line treatment. So it's a new type of treatment, which is really based on the target, what the tumor expresses, with really different treatment options with much more potential, much more outcome.
Yep. And Hans, I know that Lynch Syndrome is very rare. Are you seeing many cases of Lynch, and are you catching it early through screening?
The awareness of screening in Germany, for example, in some other European countries is more and more high, and in Germany, because the law allows screening by colonoscopy for colon and rectal cancer up from the age of 50, 55 for every person, every 10 years. And those with a family history of colon rectal cancer can start this at 45 years. If there's clearly a link or a hint for Lynch syndrome in the family, then every patient, every part of the family is analyzed, is investigated. So the culture for looking for Lynch syndrome in Europe is very, very good, very high, in UK as well, France. That Lynch patients are mostly relatively good known, or if patient has been identified, then the relatives will all investigate it.
Yeah. Well, Hans, I want to thank you for all of your hard work, and thank you for stopping by.
Great pleasure. Good luck for your work.